As a lifeguard, you need to follow standard precautions to protect yourself while providing care. At times, you may come in contact with blood and other potentially infectious material such as other body fluids that may contain blood-borne pathogens. Blood-borne pathogens can cause disease. Hepatitis B, hepatitis C, and HIV are 3 diseases that are passed through body fluids that are of primary concern for lifeguards. Anyone's blood or body fluids might carry disease-causing germs. Someone you know well, or even someone who shows no obvious signs or symptoms, could be infected. Following standard precautions, you should treat all blood and body fluids as potentially infectious material. By following standard precautions, you can minimize the spread of infection while providing emergency care. Standard precautions include the use of personal protective equipment, good hand hygiene, engineering controls, work practice controls and proper equipment cleaning, and spill cleanup procedures. When exposure to any potential infectious material might occur, it's important to use personal protective equipment. Personal protective equipment includes nitrile latex-free disposable gloves, breathing barriers, protective eyewear, and any other specialized protective clothing that will keep you from directly contacting infected materials. Wear nitrile latex-free disposable gloves when providing care. In addition to disposable gloves, wear protective coverings such as a mask, eyewear, and gown when there is a likelihood of contacting blood or other potentially infectious material that may splash. When giving ventilations to a victim, use a CPR breathing barrier or bag valve mask resuscitator. After providing care, follow proper procedures to dispose of soiled equipment and clean up any blood or potentially infectious material that may have contaminated the area. Take the same precautions in disposal and cleanup as you do when treating the victim. Anytime you might come in contact with body fluids, you need to take deliberate action to prevent the spread of infectious disease. A blood spill kit should be available to safely clean up blood. Follow the procedures outlined in your facility's exposure control plan. When removing gloves, be careful not to touch your bare skin to the outside of either glove. First, pinch the palm side of one glove near the wrist and pull the glove off so that it is inside out. Holding the glove in the palm of your gloved hand, slip 2 fingers under the wrist of the glove, pull the glove off inside out so that the first glove you removed is inside it. Dispose your soiled gloves in a biohazard bag and wash your hands. Proper hand washing is the most effective method of preventing the spread of infection. To properly wash your hands, thoroughly scrub them with soap and warm water for at least 15 seconds, giving added attention to fingernails and jewelry. Standard precautions are simple to remember. Always use personal protective equipment when caring for a victim or cleaning up a scene when any body fluid is involved. Properly dispose of your personal protective equipment and follow proper procedures to clean up after providing care. If you don't protect yourself on the job, you can't protect the people that count on you.